Greetings and welcome to Wisconsin in Focus, powered by the Center Square. I am Dan McCaleb, executive editor of the Center Square Newswire service. Joining me today again is Benjamin Yount, the Center Square's Wisconsin correspondent. How are you, Ben?
Getting ready for fall. The fall temperatures literally arrived. It was 82 on Wednesday. It's going to be 58 on Friday. So I have to go and dig out my sweatshirts and my jeans. I've been wearing shorts around the office since April, so I got to find some actual pants.
We've had similar weather here in the northwest suburbs of Chicago, Ben, just about 20 miles from the state line. Highs in the 80s, but that's going to dip come the weekend here. So, Ben, in what I'll refer to as the no-da story of the week, the head of Wisconsin's Department of Health Services conceded that public health managers in Wisconsin made mistakes in the early days of the COVID-19 outbreak. Of course, as the pandemic began, Wisconsin and other state governments across the country shut down what they deemed to be non-essential businesses in early months of COVID, including in Wisconsin, leading to massive layoffs and other economic disruptions. Schools also were closed, forcing students to learn remotely, which led to massive learning loss in Wisconsin and schools everywhere. You covered this admission, Ben. Tell us more about it.
This is one of the rare times when someone in government actually comes out and says, yeah, we got it wrong. We made a mistake. And it doesn't help, as you said, those small businesses that closed and never came back. It certainly doesn't help the hundreds of thousands of school kids across the state, including an awful lot of kids in Milwaukee who lost a year or more of their school experience. I mean, you had kids graduate high school who missed 2 years of high school because they got sent home because of the virus. Now, Kirsten Johnson is the secretary designee. She has not yet been confirmed by the Senate, but she's the new boss of the state's Department of Health Services. She was not the boss at DHS back when the coronavirus was in its early days and during the worst of it. She ended up in Milwaukee. So it was sort of, she had the largest public health department in the state, but not the state's Department of Public Health. And so when she said we got it wrong and we'd obviously do things differently now, it was a bit of something to hear. The quote we had in the story, she said, we certainly made mistakes. Part of this is that it was a novel virus. We didn't know what we didn't know, and we were making the best decisions we could out of a host of bad decisions. The problem with that, the hole in that donut, is that by the end of the summer of 2020, Republican lawmakers in Wisconsin were pretty clear who was getting sick, who was at risk. Older folks, people who were sick, people on the heavier side. The numbers all bore this out, but yet the Evers administration, including the Department of Health Services and Kirsten Johnson in Milwaukee, continued to push for blanket closings. They pushed for social distancing. They pushed for mask mandates. They pushed to close the schools to isolate people. And so when she says now that yeah, we made mistakes, would we make some of the same decisions today? She said absolutely not. It didn't do much to it doesn't make anybody happier here 2 years on. And this has left a legacy. You got to remember that if Wisconsin's Republican legislature didn't sue, didn't go to the then conservative majority Wisconsin Supreme Court, Wisconsin could very much have looked like Illinois or California or New York, which were shut down much longer, which had much tougher policies on social distancing, which kept schools closed even longer than the state of Wisconsin did. Some school districts were back in the classroom by the fall, by that, the summer, August of 2020, couple of months after the outbreak began. Certainly most were back by January of that next year. And so Wisconsin still has a lot of hurt feelings. There are still a lot of Republicans at the Capitol who are not happy with how this state handled the coronavirus. And while this is always an interesting admission to say we made mistakes and we wouldn't do those things again, there were some Republicans who were saying, yeah, too little, too late.
Yeah, and of course, this was not an issue isolated to Wisconsin. States across the country shut similar things down. One of the most frustrating things for me was when it came to, governors essentially got to determine what were essential businesses and closed significant portions of the economy, but left, smaller portions of it open. In California, Governor Gavin Newsom there shut down churches, saying churches were not essential to people, but left open marijuana stores and liquor stores and things like that. That did not happen. There's no legal marijuana in Wisconsin, of course. Ben, you and I like our beer, so we were glad we could drink beer during while we were sitting at home waiting for things to change. But it's clear that there were mistakes made in Wisconsin and across the country. And let's hope our elected officials and our health officials at least learn from those things.
That's the thing to remember, because we're not done with COVID. Wrote a story not at the Center Square, but for the radio last week, where Madison public schools, are taking a look at the rising number of COVID cases. Fewer than 1% of students and teachers in the schools have tested positive, but there's talk of bringing masks back to public schools. There's talk of perhaps reinstituting some of these 2020 ideas, and not to fall down this podcast rabbit hole, because I'm sure that there are plenty of tinfoil hat folks and people with, advanced medical degrees. Some of this comes back to how these public health managers talked about the vaccine and the virus and who is protected and just what a shot would do and who is at risk. And so we still haven't settled out any of that. This sort of washed over and passed, and folks in Wisconsin were happy that they could go back to the store and go back to church, go back to the bar, go back to work. But the lingering questions of just who did what and how much power public health managers took during this, that remains unresolved. And as we head into a fall where almost every expert says, yeah, you're going to see more COVID cases, this is not an issue that is dead. This is not a past tense issue. This could be a present tense issue for a lot of people across Wisconsin again this fall.
Well, let's hope for residents' sakes, students' sakes, everybody's sake, Wisconsin officials use more common sense, because as you said, as winter comes, we're going to see more rising cases from COVID, just as we see more rising cases from the flu, head colds, things like that. Now, COVID's a little bit different, but we've learned to live with COVID. We learned what the most effective treatments are and mitigation factors are. So let's just use some common sense. Ben, that is all the time we have, though. Listeners can keep up with this ongoing story and more at thecentersquare.com. For Ben Yount, I'm Dan McCaleb. Please subscribe, and thank you for listening.